to the Ask Me Anything with Dr. Twyman. Here to answer your questions about things that are related to vascular disease, try to help you not have a heart attack or stroke. That's my mission. My practice at Plaque is in St. Louis, Missouri. We've been open for 6 years, and this is what we do. We take care of people from all over the country, and we've recently had somebody come back from Australia to come see us. So if you're still potentially want to work with us, we work with people from all over. Go to my website, drtwyman.com, and you can apply. I do still have some slots for 2025. A couple other housekeeping things. The Canyon Ranch Retreat is starting to fill up. That will be October 29th through November 2nd. If you're still interested in potentially attending, the events will be more casual in nature, but I'm planning to go hiking every day. You're more than welcome to join the hikes if you would like. Have breakfast with me. We'll do some Ask Me Anythings live. Maybe we'll do some poolside chats, and then I'll walk you through some of the activities you can experience at the Canyon Ranch that can help optimize your mitochondrial function if that's what you're interested in learning more about. If you're interested in that, again, go to my website, drtwyman.com/retreat or /ranch. Those will have the information about how to potentially sign up for the event, but you got about 2 weeks left before it closes. And then the last piece of housekeeping data is I do have a school community. I've been dropping data in there almost every single day, or content I should say every day in the past week or two, talking about my updated ideas on hypertension management, nutrition management. There's a video in there that I put together using AI that summarizes 30 of my top podcasts. So you take 30 to 60 hours of my content and can distill it down to a 6-minute PowerPoint slide. So for those that are new to my content, this is a good refresher on what topics you're going to be hearing about on every Monday night IG Live. So if you're interested in that, there is this free 7-day trial. If you go to school.com, SKOOL.com, my group is known as Heart Attack Proof, but I made it a little bit easier. If you go to drtwyman.com/school, SKOOL, or if you misspell it, it will direct to my Heart Attack Proof group on school. And you can look around for 7 days, see if it's worthwhile. There's some courses teaching how to read your own labs. I have a whole thing in there about how not to die. So basically what tests to get to look at your vascular system. So a lot of the questions that get asked here, there's a lot more depth in the school community. So with that being said, we'll start with the great questions that got asked tonight. First question, the last stress test was negative. The person wants an echo this time to avoid the radiation. It appears they're 77 years old. They're on a statin. The calcium score is 675. Thoughts? So I can't answer one-on-one questions or tell you what you should exactly do, but in general, if your calcium score is over 400, you're considered high risk, and it may be reasonable to do a stress test at that time to evaluate if there's any ischemia. Ischemia means lack of blood flow. If you have a normal stress test, there is little reason to repeat stress tests routinely. It's not even in the guidelines that people should be doing routine stress tests anymore. Stress tests are best in people having symptoms. If they're having chest pain, shortness of breath, exercise intolerance, then put them on the treadmill and see what they can do and see if it's related to an issue with one of the coronary arteries or microcirculation. If people are wanting to avoid radiation, the stress echoes, where they put an ultrasound probe on the heart, take a picture before the exercise you, and then take a picture of the heart with an ultrasound probe. A big exercise, which I used to do all the time when I was still in the hospital system. Its sensitivity and specificity is very close to nuclear stress tests. So if you don't want the radiation and you're really thinking you need a stress test, stress echo would be a good option. But that being said, most patients I don't do stress tests on unless they're having symptoms. How often should you re-image a calcium score? If your score is 0, probably every 3 years. If your CT angio is abnormal, then it depends on what you're trying to do. If you have a lot of soft plaque on a CT angiogram, probably would wait at least 1 year bare minimum, but I usually wait 2 years before repeating a clearly CT angiogram to assess if the low density plaque is regressing. Go-to supplements for blood pressure. There are no go-to supplements. It's find the root cause and remove the lever that's affecting the blood pressure, because blood pressure is not a disease, as a response to something in the environment. So supplement what is deficient if you do a workup, but omega-3s on occasion will be useful. Supplementing nitric oxide if you can't fix why they have low nitric oxide. The DASH diet, the dietary approach to stop hypertension, is the preferred diet. And exercise, it's a combination of cardio. HIIT training can work if you're generally conditioned, but would focus more on kind of the low and slow cardio. And if that still doesn't do it, then do a workup. Find out if it's renin aldosterone, is it nitric oxide, is it inflammation, oxidative stress, heavy metals. There's something driving the blood pressure, sleep apnea. So do the workup and remove the offending agent first, and then you can talk about supplements. Somebody says, being very low in vitamin D and being anemic with low B12, would this affect heart health? It may. Vitamin D is an important hormone. It's important for lowering inflammation. It's important for blood pressure. Anemic, you need oxygen to make oxygen in your mitochondria, and approximately your heart is 1/3 mitochondria. And then B12 is effective for many processes in the body, but you need it to methylate and detoxify. So if you can't detoxify, then you may have high oxidative stress and inflammation. So all three of those things can definitely affect cardiovascular health. What is the role of calcium in the body? It's an electrolyte. It's important for cardiac membrane stability. The electrical impulses in the body have calcium, channels. So it's very important. You get calcium from your diet. Your gut brings it in, in the presence of vitamin D hormone. And with vitamin K2, the calcium is supposed to be deposited into your teeth and your bones. If you don't have enough vitamin K2, then you may deposit calcium in the vascular system. This is why supplementing or vitamin D without vitamin K2 is often a bad idea. You drag out a ton of calcium from the gut and it goes places you don't want it to go. The plaque that forms in the arteries, does it have calcium in it? Potentially. Calcium is the stabilizing factor for a plaque. What is plaque composed of? Oxidized lipids, white blood cells, macrophages, smooth muscles, calcium, fibrinogen products, clotting factors. A lot of stuff is in it. Think of it as like a red hot pimple. If it ruptures, the blood will clot. Calcium is a stabilizing factor, but not all plaques have it. Calcium is usually a more stable plaque. Does too much plaque and too much calcium affect oxygen uptake and its utilization? It may. If you can't get enough oxygen into a tissue, then you can't have cellular respiration occurring. How does the body use oxygen and nitric oxide? That's how you release oxygen from the red blood cells. You need both of those present. You need oxygen for the mitochondria to beta-oxidize fats and utilize glucose for energy. Nitric oxide is critically important for your immune system. It's important for your vascular system. It's a vasodilator. It's antioxidant. It prevents lipoproteins, white blood cells, platelets from sticking to the lining of the arteries. So both are extremely important. And that's what we look at, in my practice, is looking at, is anything affecting your nitric oxide pathways, or if you're anemic and it's affecting oxygen. Next question, coronary microdysfunction and possible vasospastic. They have underlying shortness of breath, low blood pressure, fatigue. Those are common symptoms. Microvascular disease is not uncommon. You have 60,000 miles of blood vessels. They all have a glycocalyx and endothelium. If the microcirculation doesn't dilate, you can't get oxygen nutrients into those tissues. You can't make energy effectively, can't get waste products out. So definitely can drive fatigue and shortness of breath. But if you're already starting with low blood pressure, it makes it a little bit harder because some of the medications that are used for those conditions will have an effect on blood pressure. So this generally requires a workup to figure out, okay, what is driving your blood pressure as low as it is, and what might be driving things that are affecting some of the nitric oxide pathways. That's typically what I see in the practice. Or the person has significant issues with EMF exposure in their homes, or they get really no significant infrared exposure. They're not doing any grounding. There's some reason why they're getting issues with the hypotension, and if you treat that, then potentially the blood pressure is stable enough that you can use other medications if you're still having symptoms from vasospasm or vasospastic activities. Have I seen plaque progress when ApoB is maintained under 65 and normal inflammation markers? I've seen plaque progress, get worse. I've seen plaque regress. It really depends on the health of the endothelial glycocalyx and the underlying endothelium. If you have high levels of ApoB, there's just more potential to develop plaque. But if you typically have lower oxidative stress inflammation and low lipoproteins, less likely to have plaque progress. What information does a carotid artery scan provide? It depends on which type of scan. There are two. Carotid duplex scans look at flow of the blood in the carotid arteries, which are the arteries on the side of your neck providing blood flow to the brain. The velocity can tell you how much stenosis potentially is present. Think of your, putting a finger over a garden hose and the water accelerates. The faster the water accelerates, the more blockage there is. There's stenosis in medical terms, But in my practice, we will do a carotid intimal-medial thickness scan. Uses the same ultrasound probe, but uses different software. So instead of measuring just the flow of the blood, you're actually measuring the plaque. You're looking for the soft and hard plaques in the artery wall. And you're also looking at the intimal thickening. The intima is the lining of the artery underneath the endothelium. If that layer is thickened, then there's inflammation in the artery, and the person's more prone to developing plaque in their arteries. All right. So excellent questions as always, guys. I have a few popping up in the comments we'll answer, but for those that are just joining, thank you. Every Monday night, 6 p.m., we do these Ask Me Anythings. In my story, early Monday morning, I put the Q&A box. If you want to submit your question ahead of time, that's the best way to make sure that your questions get answered that day. Thoughts on Neo40 for moderately high blood pressure? It has a role. It helps with smooth muscle relaxation, and there is some data. Dr. Mark Houston had done studies with Dr. Nathan Bryan back in the day with Neo40, and it does have some benefit at lowering blood pressure. Question, TRT help blood pressure? Not generally. It's sometimes the reverse, is that overdoing it with hormone replacement therapy can actually worsen blood pressure through multiple different pathways. It may affect inflammation. It may affect endothelial function. It may increase red blood cell production enough that the viscosity of the blood causes blood pressure to rise. So TRT does not generally lower blood pressure. It may increase it. All right, so somebody's looking to schedule their first cardiac CT for calcium scoring. Is there anything specific they should remember while choosing an imaging place? The CT coronary calcium score is known as a dry scan. There's no IV. There's no preparation for it. There's no beta blocker that you need to take to significantly lower the heart rate. But typically, they'll want you not to have caffeine before the test so that you have a slower resting heart rate. Because if there's motion artifact, there may not be as good of a quality image, and they may not get a accurate report. But typically, the calcium score test, that's usually not an issue. The calcium score, typically in most cities, is somewhere between $75 and $300 US. It really is pretty much an automated test, so it doesn't require the expertise of a radiologist like a CT angiogram does, where you actually have to visualize and quantify how much stenosis is present. The dose of radiation is generally relatively low with a CT calcium score, but if the person is now requesting to actually getting a CT angiogram, that's a different story. So I think somebody then says that in a different question. Sorry, I was mixing up the questions, but the calcium score test, don't have to really ask anything specific. You could try to ask them what their amount of rads are, but most of them are going to be very low. So a different person says that they need to have a CT angiogram, but they can't tolerate the contrast. Feels like their head is going to explode. So that sounds like it's a intolerance instead of a true allergy. If people have an allergy to contrast, they sometimes can be premedicated with steroids and antihistamines, which that's what I used to do when I was in the cath lab and had to give people contrast when they had a contrast allergy. But if you can't tolerate the contrast from that type of symptom, then you're going to have to talk to the person ordering the test and see, is there an alternative type of test you can do. Before a calcium score, can you take atenolol right before? If that's a normal medication you're prescribed, yes, but you generally do not need to take it one off before a CT angiogram. But before a calcium score test, you generally do not need to take a beta blocker. But before a CT angiogram, oftentimes if your heart rate's not below 65, a beta blocker may be prescribed, and then they generally will give you nitroglycerin during the administration of the contrast to vasodilate the artery so they get a better picture. All right, so waiting for a few more questions to pop in. So to summarize, to those that are joining, the school community is live. I've been posting almost every day a new piece of content. Last week posted about my ideas on hypertension, went through how to utilize this device to lower your blood pressure, how accurate are these blood pressure monitors that are not FDA approved, is the Connect UT a good device, should you be monitoring your central blood pressure? That's all in that video. I did a video on my ideas on nutrition, which I don't talk about in depth very much on Instagram because it's usually a one-on-one thing with my patients at Apollo Cardiology that I really get into the nitty-gritty on their nutrition. I have a whole video up about how I think about scanning people for vascular disease. That video is called No Time to Die. It's in my school community. And then I'm also starting to release things on how to interpret your own labs. So I've done once before and reviewed my own labs. There's a new one up there that I just dropped last week, and it's only in the school community for now. Right now, the school community is free for 7 days. So if you want to check it out, see what it's about, go to it there. It's drhyman.com/school, spelled SKOOL. If you go to the school.com website and are getting lost, just search for my name or search for heart attack proof, and you should be able to find the group. So 7-day trial there if you're interested. And then also the Canyon Ranch retreat is October 29th through November 2nd. There are still slots available. People are booking, right now. And so at some point this may fill up, but we got about 2 weeks left before the registrations close. And it's at drhyman.com/ranch or /retreat, and you'll be able to get the information about how to sign up for that event if you're interested. So somebody says, what options? Depends on why you're getting a CT angiogram. So may need a invasive coronary angiogram, or maybe need an MRI or MRA. All right. Well, I don't see any other questions coming in, so I will sign off here in a moment. Appreciate your guys' time and attention. Monday, 6 p.m. So I will be back here in Instagram. But if you're looking for my long form video, some of my older stuff will be on my old YouTube channel. There'll still be stuff dropping there on occasion, but the greatest majority of my content going forward is going to be in the school community. So hope you guys have a great week. I'm going to go back to my training. I got to get ready for Kilimanjaro. So have a great week and see you next time.